All right, RT Sidebar, Barflies Worldwide. It's your buddy Matty P. I'm here with JJ the RT, his lovely wife, and producer Alicia Valdez. But we have a glorious guest on today. Chrysalis Ashton is on. She's going to talk about home care. She's going to talk about emerging leaders, what it's like to be a leader, and I get to pass the torch to my buddy JJ. JJ, this is your episode, brother. I'm super excited. Let's crank this out. Just so everybody knows, I screwed up the last time. So this is take two. Take two. So I hope you're ready for take two. RT Sidebar. Stay tuned.
All right, you guys. So we are here, Barfly Nation. We are here with another episode. We have Chrysalis here with us. She is and has graduated from the Emerging Leaders program, and she has taken her career down a completely different path than what would be the quote unquote norm of respiratory therapy. And she may think completely different because this is her norm, right? And sometimes we have to kind of shift our thinking from our norm and understand what other people's norms are. So, Chrysalis, welcome to the podcast.
Thank you for having me. So excited to be here.
Oh, this is going to be so much fun. This is super relaxed. As Matt said, this is take two. So it's going to be just as good, if not better. And we're going to start off. I love swinging big early. Okay.
Yeah.
The very first time I ever did this, we had Mindy, and I asked her if she knew she was going to be a trailblazer. So, big question for you is, why home care?
Great question. And to start off, I'm going to tell you a little bit more about my history, which will make sense in a moment. So I started my life as an RT, as many of us have, in acute care. And I worked with adults for a little while. And then what I thought was my dream job was in neopetes. And I got that dream job very shortly after graduating. And I was just so thrilled. I thought this was it. This is the way I want to go. I want to do transport. I want to do all the cool things, right? And I lasted approximately 6 months in that role. NICU, I started in NICU. It turned out to be way more emotionally difficult than I was anticipating, especially as a new grad. I like to say nowadays that if I really wanted to go back to neo, I could, now that I'm mature and a little bit more intelligent than I was then. But at the time, it was not for me. And so I left that role. And for about a year, I actually took time off of work and didn't do much of anything. And I was really upset, thinking that maybe I am not cut out to be an RT at all, because I couldn't handle the highest acuity patients and the most delicate patients that we serve. And that was a pretty tough time for me. And so eventually I came to my senses and thought, I spent all this time on this education. I'm not going to waste it. But what else can I do? And of course, there's always going back with adults, considered that. And then I just so happened to see a posting for a home care role in my local area. And it happened to be with the home care company that I had done a clinical rotation with in school. And so I knew the RTs, I knew kind of the routine a little bit, and I had a good experience during that rotation. So I gave it a shot. And here we are, almost 10 years later, and a new company, but still in home care. And I've kind of established myself as the new home care girl out in our respiratory world. It's a passion of mine.
So you have gotten a new title as the home care girl. That's a different title. So tell me a little bit about your time as a student going into the home care rotations, because my experience was we got 2 rotations in the entire program, and I showed up for my rotation and they said, student, we don't have anything for you to do. And I was 19. I mean, I was showing up. If you give me the day off, I'm taking it.
Yeah.
I was going to study, I was going to take that day and study.
Right.
Shout out Bob Weidman if you're hearing this right now. But That was my clinical experience as a student going into home care. They said, we don't have anything for you. You can take the day off. We'll sign whatever paperwork you need and go. So what was yours like?
Well, first of all, I want to apologize on behalf of our industry for your experience, and that is part of the stigma of home care that I am personally trying to overcome and break free from. So my experience was much better than yours. We did have a full week in the program that I was in, and I got to spend time with several different RTs doing several different things. There was a ventilator specialist at that company at the time. I got to spend a lot of time visiting the chronic ventilator patients and chronic respiratory patients that they followed. There was a pediatric specialist, so I got to spend time at the children's hospital with that person. And then there was the therapist that did a lot of the oxygen testing and all of that too. So I had a very good and varied experience. And the RTs also were just wonderful humans. So that is another reason I wanted to go work for that company at the time. So now, unfortunately, the same program that I graduated from has cut their home care rotation down to 2 days. And the only reason it is 2 days and not 1 day is because I am on their advisory board and I insisted on having at least 2 days. So I got 2 days out of them. They also allow me to give a lecture and run a lab on home care ventilation. But that has been kind of a tough fight for me. So my my passion is that chronic respiratory patient. So that patient with COPD or a neuromuscular condition who doesn't want to live in the hospital, who wants to live in the hospital, but they are going to have this chronic condition forever and they're going to worsen, unfortunately. There's no cure for these things. And they want to live a normal life. And once they leave the hospital walls, the RT fixes them up, sends them out, gets them all fluid balanced and medications on track. And then what? Nobody really knows, right? You don't know what happens to that patient or their family or their situation. The RTs in the home care space get to have that experience and get to walk that journey with those patients, which is incredibly fulfilling as a profession, for our profession and for me personally and other home care RTs. It's really about building relationships. And I hire a lot of RTs, of course, as most leaders do in organizations. And the ones that I often get applications from are RTs that have worked in a hospital for many years and they're feeling burnt out, which of course happens. And really the piece that they pull out of that is, I want to get to know my patients. I see them as frequent flyers, but that's not how I want to see them. I want to see them at home, thriving. I want to get to know them and their family, and I want to help them meet their goals. And that's how I know that NRT is potentially going to be a great fit for us, is if that's the reason that they want to pull out of the hospital, because they want to really help that patient on the rest of their journey, not just get them out of the hospital.
It's interesting you say that, because when I think of home care, that's like where RTs go to pasture.
Yeah.
But you're saying that, really it's a different skill set, and it's more relational, right? So
Correct.
So how, like what exactly, what type of person are you looking for? Like, it's not like you have to have the desire, but like, what is it, what makes a great home care RT?
Yeah, great question. So the misconception with home care is that it is an easy job, and I absolutely hate that stigma and that conception. So the other subset of RTs that I get applications from are the ones that are burnt out, which is understandable, that have been working night shift for their entire career, whatever the case may be, and they want an easy job. They're expecting to come in and sit in an office and set up a couple CPAPs and make a couple phone calls and go home. And that is not at all the entirety of the job that we do. And so the RTs that I need are RTs that are very confident in their clinical judgment skills and their clinical skills in general. Because what many people don't realize is, when you're in the home care space, the RT is kind of the top of the food chain when it comes to clinical services. We don't employ physicians, PAs, NPs, nurses sometimes, but it's less common. We are really the king of the castle, so to speak. And so anything clinical, respiratory, questions, issues that come up is going to come to the RT. And that includes working with pulmonologists, primary care physicians, any other type of outpatient service. They are looking to us to be in that patient's home, looking at their settings, their vitals, their testing, whatever the case may be, and make recommendations. And surprisingly, that's that's challenging for some RTs that are used to being in a hospital and working, just taking the order from the doctor, punching the numbers in, making the changes, doing the tests, whatever, or working under a protocol where you know exactly what you're allowed to do. Nothing wrong with that. And of course, we still have to function under a doctor's order in the home care world, but we really have to be the experts. We have to make those suggestions because the physician's not in the patient's home. And they often don't understand the dynamics, and they aren't seeing the patient as often as we are. So they really look to us to make some suggestions, whether it's a setting change, an equipment change, additional therapies, additional testing, whatever the case may be. So I need somebody that is okay with being independent and autonomous, who is very confident in their clinical skills, and is okay with being quote unquote alone. You're never alone. I like to tell my RTs, you can call me any time of the day or night, and they do. And there's also many other RTs in our company and elsewhere that are resources. But when you're in the patient's home, you're pretty much by yourself. You are physically there alone, and you're dealing with the family dynamics, the patient condition. There might be animals in the house. You don't know what kind of situation you're walking into. So you have to be comfortable with that. You really do. And that is a skill set that you don't learn in school by any means, and don't necessarily learn in the hospital either.
Yeah, and you know, part of being an educator is we actually have a home care class, right? And so whenever I get the opportunity to meet experts like you, I always tap into you guys and ask, like, what are the key things that my students need to take away from your expertise? And one of the things that we've talked about is that wraparound services. Like, it's more than a respiratory therapist. Like, you are there to listen to their frustrations, their concerns. You know, sometimes we don't know what's going on with their family dynamic and their situation. There's just a number of different factors that can be causing stress and distress, and it's all about bringing the human element back into home care. It's bringing care of a human back into healthcare. And that is something that, you know, in the hustle and bustle of a hospital, you can kind of get away from, because I fell into this trap too. Is I have 75 breathing treatments to give, and Miss Johnson isn't Miss Johnson. She is room 542.
Yeah.
You know, and you fall into that, and utilizing that time and getting to know that patient and really spending time with them to get to know them as a human, right? And developing that relationship, it takes a different stance, because you are with these people long term. You're not there for the acute, you know, short haul, get them over the hump and then get them back home, you know? And so when you look at those types of building that rapport and building that relationship, you know, Alicia, we have somebody that's in our church family that has somebody that just left a different state to move to Victoria to be close to family, because now she is trached and pegged, and she's going to be a long-term trach and a long-term peg, but she does have the opportunity to gain strength back. And I had one encounter with this person. I wanted to say patient. I had one encounter with this person, and I'm like, what can I do so that I can serve this person at home, even though I'm not affiliated with a home care company at all? What can I do as JJ, the RT? What can I do? And, you know, luckily I'm affiliated with some good, like, I've grown up with some folks in the industry where I now have a nurse prac friend that I can work under and alongside, and I can go assess and evaluate our friend and help get her the treatment that she needs when, you know, she's in distress, or if something changes in her status. So I love the fact that, you know, it only took one encounter for me, but how much more, or how many more occurrences are there like that in home care?
Oh yeah, many, and I love your description of you know, meeting that person where they are and getting to know them as a human. We often refer to it as becoming part of their family. Truthfully, we become part of their family. We get invited to birthday parties and graduations and weddings and unfortunately funerals, which is a part of that as well. And we get so much feedback back from our community that, thank you so much for being here for mom, dad, grandma, grandpa. And Mrs. Johnson isn't just room whatever. She is the one that has the chihuahua and takes these 10 medications and loves flowers, and her favorite color is purple. And we actually get to know all of these things, and we've done some really crazy and silly things. I have a funny story that I wanted to share. There was a patient who at some point in their conversations with the RT was talking about easy bake ovens and how as a child they never got to have an easy bake oven. It came up somehow in conversation. And this RT went to the store and bought this patient, this individual, an easy bake oven and brought it to her and set it up. And she was just so delighted. And I think she has since passed away, but like she talked about that until until the day she died, about how this individual had gone out of his way to do this. But that's what you want to do when you start to take care of these individuals, because you truthfully feel as if they're a part of your family and you're a part of their family. And you really can't replicate that in a hospital most of the time. The closest that we can get is our frequent flyers, and sometimes we do get to know them very well. But ideally, we don't want to see them over and over again. We want to keep them out of your ERs and your ICUs. And that's where the home care RT comes in. Also, I wanted to mention this a little bit too. With the healthcare landscape right now, I mean, this has been going on for quite a few years now, but Medicare penalizes hospitals for these chronic respiratory patients that come back into their facilities within 30 days. And once they leave those hospital walls, what really happens to them? They might get a call from a pulmonologist or a care manager every once in a while, but it's very difficult to have healthcare providers that can go into the home and actually see what's going on and try to catch some of those infections or those issues ahead of time so that we can potentially treat it at home. And that's where home care respiratory therapy is the future of healthcare, in my humble opinion, because acute care is just not where we want these patients to be. If we can comfortably manage them at home, why wouldn't we? It's more cost effective. Everybody's talking about costs and healthcare cuts and all of that right now. It's much more cost effective. And it's where the patients want to be. It's where their families want them to be. It is a better quality of life for them to be in their home and not constantly in and out of the hospital. And just knowing as a respiratory therapist that has gone down this route that I have a very significant impact on that, it's the best thing ever. That's what gets me up in the morning. That's what brings me in the morning, is knowing that impact that I'm making.
So I had a question. You were talking about Medicaid. I'm sorry, Medicare. But what about like Medicaid, like the lower income, like rural and lower income patients trying to access this type of home care? Like, have you ever faced, like, what's their challenges that they usually face?
The challenges there, we do service a lot of Medicaid members across our company, and I know a lot of other home care companies do as well. The challenge becomes really access issues when it comes to transportation. So they can't get to their physicians' offices as well as the other patients might. They may not have a vehicle, or they might not be able to take time off of work to go in to have appointments because that's their lifeline. Yeah. And so we do have to be creative sometimes with that, and we have to consider those things, because we do have patients that will have come in to see us and not necessarily go into their home. But if they're not able to, we have to be respectful of that, and we absolutely are. The other concern, and I don't want to get too political or anything, but Medicaid doesn't allow as much when it comes to supplies and services as some of the other commercial insurances do. And so we also have to be very considerate and creative when it comes to, I'm just going to use CPAP as an example because that's a heavy home care item still. They aren't allowed to get their supplies, their disposable supplies, replaced as frequently as some other insurances. So we do a lot of donations. We do a lot of just kind of, we know you need this, you have to have this therapy, and your mask is falling apart. So we're going to take care of that. So there are definitely challenges, and there's definitely concerns right now with the current landscape as far as what's going to happen with Medicaid and how might that affect durable medical equipment and home care services in particular.
Yeah, Matt, I know you're going to talk about it here in just a minute, but the RCFT is an organization here in Texas that looks to maybe provide some funding for some of those disposables, especially in the lower income population. So, when you get those fundraising opportunities for your state or even for the ARCF, sometimes those funds actually go to organizations like Chrysalis's so that they can get disposables for patients at the bedside or, at home.
And we a lot of sleep and physician offices too that will often have some sort of a bank program where we have patients that will pass away, and if they have excess supplies that they haven't used that are unopened, they will often donate them back to us, and then we donate them forward to whoever needs them from there, either through one of these bank programs or just through us. Us in particular will help those patients that need it. And I obviously can only speak for the home care companies that I've worked for, but in general, that's a pretty common practice. Like, we want patients to have what they need.
I think this is so interesting, and I think, Chrysalis, we're probably going to have you back at some point. It's not really about political stuff. It's not really about Medicare or Medicaid. Like, we can go into that, but I think we need to have you back because this is important. It's the work that you do, and it's about social determinants of health.
Absolutely.
We can get snarky in the hospital. Hey, why didn't you take your inhaler? Well, maybe food was a little more important, or childcare was a little bit more important. I think that the work you do, the people you bring around you in home care, the people that you hire really understand that better than we will ever understand in the hospital. So I think there's a lot for you guys to teach us.
I agree. And I know this is not just our company that is doing this, but it's becoming a lot more common across the country. Home care companies are starting to develop actual disease management programs where an RT not only provides the equipment and the education, of course, but they're actually visiting with these patients just on a regular cadence, even if they don't necessarily need anything. And that is to look at those things like, do you have enough food in your refrigerator and in your cabinets? Why haven't you filled your medication that you got from the hospital? Oh, you can't afford it. Let's help with that. Do we need to get social work involved? Is there maybe a benefit to having PT? Is there additional testing or specialists that you need to see? So it's not even just all about respiratory. We really have to become very aware of the other needs. We are truthfully treating the whole person. And that is something that you just don't necessarily think about in the hospital, because you can call the nurse, to see if they have an issue with their feeding or something, or their other medications aren't doing the right thing. We really need to know that, being one of the only healthcare providers that goes into the home and visits with these people on a regular basis. And so that is something that I teach my RTs, and that as a part of our disease management program is, yes, you're a respiratory therapist. You need to know what the ventilator's doing and why their CO2 is high and what have you. But you also need to check their cupboards, and you need to talk to them about their medications and try to organize their pill cabinet. And do they understand what to take when? And, oh, you should not be taking that with this. And there's a lot more to it. So that is another thing that when RTs come into my space, like, what do you mean I have to understand about enteral tube feeding? Yeah, it's part of our clinical picture, and it's a part of the whole individual. If they aren't eating, nothing else really matters at that point. And yeah, childcare is an issue too, and we can make connections in the community that may not even be available to some hospital case managers, because we have those connections.
Students, if you're listening, pharmacology is super important.
Very, very important. Even though you think you're never going to use it, you will.
Absolutely. So, kind of to put a bow on home care here, one of the things that you said earlier is that you think that home care is the future for respiratory therapy. And I've heard it said that we don't have a healthcare system, we have a sick care system. Like, you go into the hospital when you get sick. We don't do a whole lot of things to prevent people from getting sick. So, like, the work that you're doing is really good to progress towards a healthcare system more than that sick care system. So I commend you for all of the work that you're doing. Continue to be your own biggest cheerleader. We are going to cheer for you as well. But absolutely, if we continue to push towards that healthcare system versus that sick care system, we're going to be making some waves. Definitely. Now, something that hits home a little bit more for me is
Yeah.
leadership. I love the home care stuff, but leadership is where I kind of like to
Oh yeah.
tickle the ivories, I guess is the right word. I don't know. Anyways, so as a leader, there are a lot of things that you kind of have things that you work on. There may be a book list, or there may be a mentor that you've had, or you kind of go through a program. Well, you were part of the inaugural program at the AARC when it comes to the leadership. Uh,
Emerging
oh
leaders.
my gosh, emerging leaders program. Thank you. I was thinking the Leadership Institute of something, and I was about to make my own. I was going to make my own program, but you were part of the inaugural
I was.
emerging leaders program at the AARC. Tell us what that was about.
Oh my goodness. So we call it the ELP, Emerging Leaders Program, was a life-changing experience for me. So a little bit, going to back up just a little bit. I am the clinical director for the company that I work for, and I did not seek out leadership when I started in home care. Home care was obviously a path that I took that was a little different, and then leadership was another path that I'm now on and enjoying. But it wasn't something that I aspired to right away. I had a mentor way back when who saw some things in me that he thought you could be a good leader. I took the jump and here I am now and I love it. And it is my second passion. So home care leadership, like those are the two. So the ELP program was introduced for the first time at Congress of 2023, if I'm not mistaken, in Nashville. And I took note of it then. I saw the advertisements and I heard some of the presenters talk a little bit about it. And I'm like, oh, that might be cool. I'm still somewhat of a new leader. I feel like I could learn from these individuals, and I wanted to get more involved with the AARC at that time. That was one of my goals as well. And I waited. I waited and I waited and I waited. And I actually waited till the very day before the applications were due to submit mine. And I was just thinking, I don't know. Maybe I'm probably not going to get in. I'm just this home care RT. Nobody cares about home care. And I'm somewhat young and, unknown. And then I finally talked some sense into myself again and just said, if I don't apply, I'm definitely not getting in. So I might as well try, and I can keep trying if I don't. So I was super thrilled to get that email that I had been accepted. And from there, life changing. We were paired with mentors. Shout out to my mentor, Scott Rystad, the most darling man on the planet. And just thank you so much to him for everything that he's done for me and continues to do for me. That was probably the most valuable, in my opinion, part of the program, is being assigned a mentor and basically being forced to meet with them, because you run across people and you might meet with them once and you admire them, but then it's like, no, you are required to meet with this person twice a month. And I mean, I would have met with them every day, but it really kind of keeps your butt into gear somewhat to keep a regular cadence with your mentor. And he helped me not only with in the moment issues I was having, like, oh, I'm having this really difficult employee, I need some advice, or I've got this policy I'm trying to push through and I can't get it to the upper leadership, but also helping me build my own confidence. So the amount of confidence I built in this program was astronomical. I tend to be a little bit more of a quieter, shyer person, and I've just completely come out of my shell, and it has opened so many doors for me. Amazing. So shout out to the AARC, whoever, I think Gary Kaufman was involved in this at some point with the idea behind this. So just amazing. And I'm so glad that they're continuing it. The other really awesome part about the ELP program for me was the abstracts that we were able to submit. So we had additional mentors. So again, another shout out to Katie Burr, because she is also just a phenomenal human being. She spent extra time with me to get my abstract put together, because we ended up doing small groups, but we used my data, which was home care data. So yay, more home care. And she helped me, spent extra time, extra meetings with me to get that all together and submitted. And we all were able to present at Open Forum last year. Life-changing experience. Highly recommend abstract submission and research to any RT out there for any topic. And so that has opened up my eyes also to that avenue of we need more research, and we need more research in home care. So the other really interesting part was I was the only home care RT that was accepted into this program. All of the others were either hospital leadership or educational leadership, or aspiring to be in hospital leadership or educational leadership. And so I was initially a little bit nervous that maybe my opinions, my perspectives, my input wouldn't be as relevant or as valuable because I was the only one. And not the case at all. I was welcomed with open arms. I'm still friends with most of my classmates, and they truthfully sought out my opinions on things because I had a different perspective. And everywhere I went, from summer forum to Congress, oh my gosh, you're in home care. That's so amazing. And we need more of this. We need more of you. Absolutely wonderful program. My advice to anybody that's looking at it, I know this year's cohort is full and it's on its way. Please apply for it. And also please take advantage of the new mentor-mentee hub that the AARC is putting together, because that is immensely valuable. Mentorship is how I succeed, in my opinion. It's absolutely invaluable. And poke at people if you admire them. I've done that. I've professionally stalked people on LinkedIn because I saw a lecture and I was like, I need to know this person. They are amazing. And it worked. And now I have mentors and friends that, I just saw a valuable lecture from them. So that's my advice to any new and aspiring leaders out there is seek out mentorship. But also this ELP has been one of the best things AARC has ever done for me in particular, but also for, I think, our profession.
Yeah, professional stalking is definitely okay. I've done it with Joel Brown. So
me too. I did the same thing, and now we're buddies.
Yes, absolutely. And there
we all
are
agree
so
about
many
Joel
fantastic
Brown.
people.
Yes,
we all
100%.
agree about Joel Brown. Absolutely, we've all done.
Love you, Joel. Appreciate you. Everything that you're doing. Shout out to you. That's 2 already. So I got some more coming later. But
yes.
There are always we talked about the programs that are out there. There's mentorship. There's lots of different things out there. But one of the things that I've come to realize is a lot of people who are moving in leadership have some sort of reading list. They whether you're an audio book or a physical book, there is something that you're doing to continue to develop yourself so that you can develop those around you. I'm a huge John Maxwell fan. I've actually gone through his program, and I'm a certified coach with John Maxwell. And one of his things that he talks about leadership, he says, leadership is influence, nothing more, nothing less. So you don't have to have the title. You just have to walk the walk day in and day out. And in order for me to do that, one of the things that I do is I try to continually progress myself each and every day.
Yes.
So what is on your reading list?
Great question. Another quick shout out to Scott. If anyone out there knows Scott, he is a huge reader, and his little quote is "Leaders are readers," and so that was the first assignment he gave me way back when, is a reading list. So I have a huge stack. Right now I'm reading the classic How to Win Friends and Influence People. Scott actually reads that book every single year as just like a refresher because it's so relevant. I also am a huge John Maxwell fan. I've read several of his. I really, really enjoyed Simon Sinek's Start With Why and Finding Your Why. Hugely influential, and I've turned that into a little internal lecture here. Who else? Jones Laughlin. He spoke at Summer Forum in 2024. Also professionally stalked him, and I'm buddies with him now. Love the way his books are written, because if you're not really a reader, he uses more of a storytelling system for his that has those little lessons built in, and they're pretty compact, pretty concise books. So it's not a huge, thick book that's very intimidating. You can get through them pretty quickly, and it's more of a story. So I really, really like his. The Juggling Elephants one is one of my favorites with the different rings. Highly recommend that one. I also highly recommend podcasts. So we're on a podcast right now. So if you're listening, you probably love podcasts. I really enjoy Harvard Business Review's their whole lineup. If you are a female leader out there, there is a, Women in Leadership, I think is what it's called, series, and they do all kinds of different topics. Love that. Muriel Wilkins does a Coaching Real Leaders podcast that's actual leaders that have issues that she coaches them through on this episode. Love that one. I can always relate to all of those leaders on her show. So podcasts, yay. Shout out for those as well, for development, for leadership development.
Matt, you've mentioned one to me before. What is the one that you
Oh.
said it's only like this big, but it's your favorite?
So I'm not a reader, but I'm a podcast guy,
Yeah.
for obvious reasons. Patrick Lencioni is The Five Dysfunctions of a Team.
Yeah.
And it is, the whole book is a story about a dysfunctional team. And it's so eye-opening. So when you said, hey, I really like a storytelling framework to a book, Patrick Lencioni, all of his books are this big. They're fantastic. Really, really like that one. So, but yeah, I mean, really good. Harvard Business Review does they do really nice podcasts, really nice stuff on LinkedIn. You can find them on LinkedIn, all free.
All the time. Yep.
Mm-hmm.
Yeah. So we are about to move into and get ready for the TSRC. The Texas Society of Respiratory Care has been gracious enough to allow me to run a leadership workshop for the past 5 years. And this is actually where Matt and I met, is through the leadership workshop. And we brought in Terry Miller and Gary Kaufman, and Matt was on the list too. So he was our fifth choice, but we still got him in. And so one of the things that we have going on is we've got another workshop that's happening in just a few short weeks. And that's next week.
Wow. Coming up, right?
We're gonna need to take a clip out of this and make sure it gets to the top of the pile for sure.
That's right. So when it comes to putting on workshops, when it comes to having people that help you develop, mentors and different people like that, what does the next chapter kind of look like for you as to you becoming a mentor for somebody?
Great question. I'm doing this with Scott's encouragement still. I have a new manager that I've recently promoted a staff RT up to manager, and she's doing very well. And I find that also very fulfilling. Taking the lessons I've learned and passing them on to a new leader. And what is it that I've heard before, that you should always be looking for your replacement, or should always be mentoring your replacement, which seems scary to some people. Like, I don't want to lose my job. I don't want to mentor myself out of a job, but you have to. You really have to find those other leaders to bring up with you and next to you, beside you, and eventually you want them to be better than you are. That's really the goal, is you want them to be better leaders than you are. And that is a humbling experience, but it is very fulfilling. And so I'm very excited to continue that. So I have a couple other RTs that I'm also trying to mentor, because they've got the leadership thing that I want to bring out in them.
Well, Chrysalis, we have had so much fun with you. We've learned so much about healthcare and home care, and like the relationships that are built through that. So we just want to say thank you so much. This has been absolutely awesome. We are definitely going to be reaching out to you to jump back on with us, because there's so much more that we can learn from that amazing mind that you have. So before we go, we have to do our shout outs. So let's start it off. Chrysalis.
Yes, so I have a couple. I would like to first shout out my work family. So I wouldn't be here today without the friends and mentors that I have here at work. And we are out there every day, my RTs, my clinicians, my leadership, really changing patients' lives. So shout out to my work family. And then shout out to my sons. So I have 5 sons, and they're all teenagers. And, when you're a teenager, your mom's not cool, but they were pretty excited to hear that mom was going to be on a podcast. So, hi, boys. It's me. Mom's on a podcast. Am I cool yet?
That's so cute.
That is so cool. That's so cool.
JJ, I want to shout out. I just thought of one. Cindy Frankfurt and friends at Lancaster General, my last hospital, have a great outpatient program where they really monitor these patients and work with the home care team that has fantastic success. So to Frankie, my good friend, congratulations, all that you do. This episode made me think of you, so I hope you're doing great. Also, big, huge on the 8th of June, the Respiratory Care Foundation of Texas, who is led by our good friend JJ the RT and respiratory coach Joe Lewis, gets to have a wonderful dinner. It's going to be sponsored by RT Sidebar, as well as other amazing people and amazing corporations. So great organization. Make sure that you can try to attend if you're going to be in Lubbock. JJ, you have more on Lubbock?
Yeah, we're having the entire TSRC, Texas Society of Respiratory Care, 2-day seminar with a pre-workshop. The only workshop that's out there is the leadership workshop. So if you're in the Lubbock area, if you're in the 806, if you're in the 432, get to the workshop.
Ooh,
Get to the workshop. It is going to be really, really good. We've got a lot happening. Matt is coming. Calm down. Matt's going to be there. We're going to have Mindy Conklin. Mindy, the APRT, and we have a guest that may be a secret, but really wouldn't be a secret if you know us really well. But we're going to do something a little bit different at the end of our workshop. You're going to have to pitch an idea that you've developed in our workshop, Shark Tank style. So we're going to have a Shark Tank
That's cool.
at the end of the workshop. So if you can make it, get there. If you can't make it, get there. It'll be the place to be because Matty P is going to be there, right?
Yes.
All right, honey. Your turn. You have a shout out.
Gosh, there's so many people. Okay. So I want to shout out Anita Respondic. Is that how you say your last name? I always just call her Anita. Anytime I go to a conference, she's always there. Anytime that my honey is off doing like either lessons or in a breakout session, she's always there just to keep me company.
Oh.
So she's super kind. She's sunshine and bubbles, and I love her so much.
Yay.
That is so good. That is so good. For me, I'm going to steal it and take two. The graduating class of Victoria College, as of this morning, 6 out of the 7 are already RRTs.
Oh. Yes. Yes.
That's how we do it.
God. Oh my
Love
God.
that.
That's how we do
it.
That's
They must have a great program director.
You're
Just
doing
saying.
great.
It's the program director. It's not the DCE. I tell you that.
No. It's gotta be CC, right?
The other ones,
Me.
we
It's
have
Alicia.
Courtney. Every time, honey, you are the shout out every single time.
Oh no. Oh.
We've got Courtney, who is going to help me out with our home care pulmonary rehab class. Ashley Hunt and Susana Morales. I've got 3 people plus Chrysalis is going to take over the whole home care space. I put them and I partitioned them into the pulmonary rehab, but those 4 are helping me out tremendously with my home care class because I know I can get better in this area. And what better than to utilize the people that I have in my circle to help me get better.
So excited to help with that.
Absolutely. So that's the end of our show. We thank you guys so much. Thank you to the listeners. Thank you, Chrysalis. We absolutely cannot say thank you enough.
Thank you.
And until next time, stay tuned.
David Thurman does not practice medicine or provide medical services or advice. Any clinical recommendations provided herein are solely those of the speaker. Practitioners should refer to the full indications for use and operating instructions of any products referenced before use. Hosts and producers are paid employees or consultants of David Thurman, and our guests are not compensated.